Hello, I'm Dr. Benedict Raj. I'm a cardiac surgeon who specializes in surgery for children with heart disease. Sometimes, very small babies also need heart surgery. Babies are born with different conditions. Our doctors in the neonatal ICU are so good that most of these babies are saved, they're looked after well, they survive and go home. Some of them are born with minor conditions that need a little bit of surgical support to go home earlier. Some of them have got major conditions, and this is what I'm going to be talking about now. The common problem in some of these very small babies, some of whom are born preterm, that is before the time is due, and some that are part of one of twins or triplets or multiple pregnancies, they're born with less than a kilo weight. These children have an artery that is supposed to close within 48 hours of birth. They don't close, it can cause problems to the lungs, and that needs intervention. So they give medicine, and sometimes these medicines don't work. So maybe once a month we get called to see these very small babies to close this artery called a ductus arteriosus or a PDA, a patent ductus arteriosus, and we close it surgically. We make a small incision under anesthesia and we tie off or clip that artery so that the baby's lungs get less blood and can get better faster and they can go home. The other condition is where the artery coming out of the heart, known as the aorta, supplying blood to the whole body, gets a block in one location, and that's known as a coarctation of aorta. Where there's a block, it causes a resistance to the blood flow, which increases the workload of the heart and the heart can fail. So when we find out that this is happening with an echocardiogram, we can remove that obstructed segment by cutting and joining the aorta. That is also another surgery that we do in newborn babies, even when they are very small. The other condition that we treat in these very small newborn babies is emergency complex heart disease, like total anomalous pulmonary venous connection, that's TAPVC, or a TGA. These are all terminologies that we give for different types of complex heart disease. They are emergency and they need open heart surgery, and with modern hardware, infrastructure, our expertise, technology, we are able to deliver very good results. What about children who have very complex heart disease that cannot be operated when they are so small? Usually this condition results in too much blood going into the lungs or too little blood going to the lungs, because the baby needs to breathe air, and that air has got to transfer oxygen into the blood, and that blood has to supply oxygen to the body. So if there's reduced lung blood supply, we increase the blood supply by providing an additional source of blood to the lungs using a small plastic tube known as a shunt, a Blalock-Taussig-Thomas shunt. So this is to increase blood supply. What if the child is born with excessive blood supply to the lungs? Because of a defect in the heart, there's a mixing of blood, too much blood goes to the lungs. The lungs being bombarded by so much of blood, it gets congested. It becomes stiffer. The child needs to breathe harder to just move the lungs, and that increases the work of breathing. The congested lungs is more vulnerable to get infected, so the child can easily develop pneumonia. So we have to reduce the blood supply to the lungs to normal levels. So what do we do? If this is the blood vessel taking blood to the lungs, we put a small band around it, like a belt, and slowly tighten it to make it as tight as possible to reduce the blood supply sufficiently to let the lungs get better, the child to grow faster, but not tight enough to weaken the heart or increase the workload to the heart and make it fail. So it is a very well calculated procedure that we do called PA banding. And these are the types of operations that we do even as soon as the child is born. These are some of the conditions for which we do heart surgery in newborn babies.